Welcome, everyone. I'm so glad that you could join us today. My name is Aline Sigler. I'm with Provider Outreach and Education. Also on the line with me today is Karen Curtis. She's serving as my co-host today, so you'll see her adding information and details and monitoring the chat for me. So I want to thank her so much for her assistance today. We also have Shakura Harris, who is a newer member of our Provider Outreach and Education team. So I'm glad that she's here as well. The purpose of today's webinar, as you can see here by our title, is to introduce you to direct data entry, or the DDE system. I mentioned that Medicare is full of acronyms, so there's our first one, DDE. Many of you that registered indicated that you're new users, you were just here to learn everything that you can to learn. And so my intention is that today's topic is an entry level or a beginner's course. It's also part of a series that we're doing that's focusing on using and navigating direct data entry. We have courses coming up about moving around within DDE, entering claims, correcting claims, what else? Looking at the inquiries menus. So a lot of good stuff coming up. Of course, I would love it if you could join us for all of the webinars, but if it doesn't fit into your schedule, we are recording them and they will be available as an encore on our website for a limited time and then on our YouTube channel in that direct data entry playlist. Our time together includes reviewing CMS's expectations and requirements about electronic billing. We'll then outline the different options for electronic billing. DDE is just one part of that. We'll define FIS and DDE, since those are the focus of our webinar. We'll take a look at some of DDE's capabilities, some of the advantages to using it, because it's not required, as you'll find out. We'll briefly go over how to gain access to the system, and then we'll end the first session with how to find some of the resources to enhance your learning about direct data entry. We actually have resources sprinkled throughout the presentation. So to get started and talk about some of the background information, we want to help you understand why direct data entry even exists. Why is it a thing? What is it all about? Since Medicare is a federal program, we look to and we're bound by the applicable laws and regulations. And the one that I want to mention and that we're going to focus on, and I got to pause before I say this because it's a mouthful, Administrative Simplification Compliance Act. Of course, it has an acronym, ASCA or ASCA, and it was implemented to improve efficiency and reduce costs associated with processing claims. Section 3 of that act requires that all initial claims for reimbursement under Medicare be submitted electronically. As you learn more about Medicare, you know that we outline what the regulations are, and then we tell you what the exceptions are. There are usually exceptions to that. And these are limited, and we're going to talk about those. The main exception to electronic billing requirements is small providers. The Centers for Medicare and Medicaid Services, I think I mentioned CMS before, but I didn't define what it is. CMS defines a small provider as an institution, facility, or group of providers with fewer than 25 full-time employees, or a physician, practitioner, or supplier with fewer than 10 full-time employees. There are other exceptions, and some of them are listed here on this slide. It's not an all-inclusive list, but I will tell you where you can find the rest of those exceptions that CMS has outlined. But these are some of the more important ones. Another exception is when there's more than one other insurance that pays before Medicare. So the system has trouble seeing that Medicare is the third, or what we call the tertiary payer. So we can accept those claims on paper in those rare instances. I don't know if you've ever had that happen. I don't know how often providers see it, but maybe you have seen it and it happens more often than I know about. But that is an exception when you can send a paper claim. Maybe you don't meet the criteria of being a small provider, but maybe you just don't have that many Medicare patients. Or if you submit less than 10 Medicare claims per month on average in a calendar year. So CMS realizes it may not make business sense for your facility or your office then to invest in electronic billing software, the costs associated with dealing with vendors and all of those sorts of things. So CMS does want to make sure that those types of providers aren't left out. And, by requiring electronic billing, that it turns into more of a burden than an efficiency either. There are other situations, ones that we call unusual circumstances. Those could be evaluated on a case-by-case basis. So if you find that you have to or you need to send claims on paper, those could be things like disruption of electricity or phone systems. Could be due to a storm or a disaster that's outside of your control. Usually those are expected to last more than 2 business days. So it's not just one afternoon that they're changing, the electricity poles in your area and your internet's down or something like that. It would be expected to last more than 2 business days, but it would be expected to be temporary. I live in Iowa, so here in the Midwest, we have blizzards, we have tornadoes, we have hailstorms. Some of you might be where there are hurricanes, nor'easters, other things that knock out your internet or knock out your power, and it interrupts your ability to transmit claims and get payment. So we want to take those situations into account. But again, they're evaluated on a case-by-case basis. And just know that you do still have options to get your claims in the receive payment from Medicare. The Medicare Claims Processing Manual, which is one of the internet-only manuals that's published by CMS. It's publication 100-04. And in chapter 24, it gives more information about electronic claims billing requirements, those possible reasons where a provider may qualify for what we call a waiver to submit paper claims. CMS says that providers are to self-assess. So it's up to you as the provider to determine if you meet one or more of the situations that CMS lists as an exception to that electronic billing requirement. Paper or hard copy claims are necessary sometimes. Sometimes we tell you to send a hard copy claim or a hard copy adjustment. But the time that it takes to process those is considerably longer. We have to wait for the claim to arrive in the mail. It has to be opened, sorted by clerical staff. It has to be physically keyed into the system by a person, or it has to be imaged and then uploaded. And then once it passes all the edits and audits that we have in the system, the payment floor, which is the mandatory time that payments are held before being released by CMS, is much longer than for electronically submitted claims, in an effort to be an incentive for providers to submit claims electronically. So that payment floor is 14 days for electronic claims, and it's more than twice that for paper claims. So it really does benefit all of us to bill electronically whenever possible. So it's part of that electronic billing requirements based on the Administrative Simplification Compliance Act. And so I feel it's a good idea to have a general understanding of this rule, because sometimes we do a really good job of telling you what the rules are, what you can and cannot do, but sometimes we leave out the reasons why, the reasons behind those. And so just wanted to let you know that. Now, on several slides, I have included links to resources, and the first one's listed here, and that's that Medicare Claims Processing Manual that I mentioned right here, those EDI requirements, and where those exceptions are. Section 90.1 is the place where CMS starts outlining those different exceptions. So if you download a copy of the slide deck, you have the links to those different resources. If you're listening to this course as an encore, scroll down to the description of the video, and I'll list all of the links to these resources there. Now, if you don't meet any of the exceptions to file paper claims to Medicare, you do have several options to file electronically. You can download them in batches using a clearinghouse vendor or the free billing software that WPS offers, and it's called PCACE. That's that third sub-bullet that you see listed here. PCACE is a complete self-contained standalone software package. If you use PCACE, you can create a patient database. So that's going to allow your office to file electronically for most Part A and Part B claims. It does have limited capabilities, however, so I do want to make sure that you're aware of that. For example, it doesn't integrate into office systems such as accounts receivable, inventory, or your billing software, so it wouldn't be able to post your payments automatically. So that's just an example, but it does give you the opportunity to enter patient information, claim information, procedure file information. So for those things that you bill on a routine basis, you can create a database that has the codes that you use most often, the charges that you have most often that are associated with those codes as well. Then you can also create a summary report of all the claims that you've submitted. So if you're interested in learning and obtaining PCA's software information, if you want to submit claims directly to WPS using that, it is available for download on the WPS Health Insurance website. This is our corporate site, so it's not the government or the Medicare section of the website. I did place a link here down at the bottom of the slide where you can go to get more information. You can search for PCACE on the WPS GHA website, and you can link to it that way too. So a lot of different ways to get to the same information. I realize it might be something that some of you have not heard of before, so you wouldn't have thought to look for it. And so I just want to outline all of those options. If you're a new PCA submitter, you also have to register for a WPS trading partner number. You have to complete an electronic data interchange or EDI agreement, and then download the full install of the current version of PCACE. If you've been with WPS for a little while and you get our weekly e-news listserv, you might have seen on a quarterly basis where we announced that a new version of PCACE is available, and you didn't even realize what that meant. So it is important when those quarterly releases come out that you download the most up-to-date version of PCACE and you use that when you send your claims to us to make sure that you have all the correct and current information. So I use the term EDI. What actually is EDI? It's the automated transfer of data in a specific format following specific data content rules, and it's between a healthcare provider and Medicare, or between Medicare and another healthcare plan. In some cases, that transfer of data can take place with the assistance of a clearinghouse or billing service that represents a provider or another payer. EDI transactions are transferred through a computer either to or from Medicare. Through the use of EDI, both Medicare and healthcare providers can process transactions faster and at a lower cost too. So we're still talking about different electronic billing options here on this slide. And some of you may also do billing for professional fees. Some claims can be electronically submitted into the secure side of our website or our provider portal. So you see that second bullet here, submitted in SNAP. That's for Part B providers who bill on a CMS 1500. There are exclusions also with that, but I did want to mention it because some of you might do both or work with providers who do both. SNAP, which stands for Secure Net Access Portal, that provider portal is totally separate from direct data entry. For our Part A providers, our institutional providers that bill on a UB04, at this point in time, you can't bill your claims directly into SNAP. And a couple reasons for this are that your claims are more detailed. There are more lines of revenue, usually, than a professional claim. So it's just not possible for the portal to be able to accept those types of claims at this point in time. Will we ever get there? I'm not sure, but I just want to give all the options and then outline the differences in those options. You are permitted as Part A provider to key your claims directly to Medicare with direct data entry. Those claims will go directly into the fiscal intermediary standard system that we call FIS. So that last bullet states entered into FIS via direct data entry. I have a couple resources for you at the bottom of this slide here. PCACE claim filing options is taking you to information about what PCACE is and how to get it. Again, it's on the WPS Health website, not the WPS Government Services or GHA website. And that's because EDI is a corporate department, not just a Medicare department. The second link here in the footer is the Medicare specific EDI page. So this is where you're going to get information about getting started, companion guides for using PCACE, and other EDI information, all those different things that we mentioned before. So the next thing I want to do is I want to define FIS and DDE and tell you about some of the advantages. So a lot of you may already know this, but for those of you that don't, we want to break it down just a little bit more. The Fiscal Intermediary Standard System is the processing system that was chosen or designated by CMS to be used for all Part A and Part B facility claims. Before claims processing contractors were known as MACs, Medicare Administrative Contractors, there were fiscal intermediaries for Part A. And so that's where that portion of the name of the system comes from. It's a standard system, meaning all contractors who process Part A claims have to use it. On the flip side, then, there were state Part B carriers, and they processed Part B claims for professional fees. You might also hear or see FIS defined as the fiscal intermediary shared system. We've seen it listed that way on the CMS website. So I just want to make sure that you know that those are both correct terms, whether you see it as shared or as standard. It's a shared system because all contractors are sharing the use of it. But it's also the standard system because that's the one that CMS has chosen for use. MCS, or the multi-carrier system, is the shared system that's utilized for Part B claims. Again, those are the ones that are filed on the 1500 claim form or the 837P electronic equivalent. Direct data entry is a real-time FIS application that gives you direct access for claims entry, which we've already mentioned, correction of certain claims processing issues, and also for inquiry purposes. It's a valuable tool for providers who use batch submissions to transmit claims electronically. So you're downloading them in batches, we're receiving them in batches, but then you have the choice of getting direct data entry where you can actually work on your claims, look at your claims, watch your claims, and that sort of thing. Having DDE is not required. It's a business decision that's made by your organization. You're going to be working with vendors. So there's not a cost to WPS, but there will be a cost more than likely with the vendor that you work in. So there is a cost involved. So it is a business decision. But what we're doing here is just doing our best to give you the information about what it is and what you can do with it. DDE is available for Part A providers, and that's all Part A providers. I mentioned it's not required, but electronic billing is, unless you meet one of those exceptions that we kind of sort of outlined earlier. There are many different ways to accomplish that. Today, we're highlighting the advantages of using DDE. For those of you who may not be aware of what it is or what it can help you do. DDE lets you perform tasks online, again, in real time, like checking eligibility, keying claims, checking claims, managing and working errors, and then maximizing correct payments. This is achieved by fixing claims in a suspended location, making debit credit adjustments on claims that have already processed, or even canceling a previously processed claim that will then return whatever payment you got to Medicare. The resource on this slide is an article on our website. It's called DDE Overview. And it's going to tell you about accessing DDE, getting your connection, the forms to use, etc. There's also instructions for filling out each of the forms. We're going to talk about them in just a few minutes. There's also information on if you need help with navigation, logging in, you need your password reset, those sort of things. So let's take a look at what you can do with DDE. You're able to monitor the claims that you've submitted, whether you keyed them individually into the system or that you've transmitted in batches. This is your window into your claims. Once they get into FIS, remember that's the Fiscal Intermediary Standard System, you can manage errors, check beneficiaries' eligibility information, and master record on what we call common working file. And then, as I mentioned, you can access certain informational files that will assist you with claims processing. We have a separate webinar that will talk about using the inquiries menu and what all is available there. We're going to discuss each one of these things in just a little bit more detail here. This slide contains a link to the DDE manual. I highly recommend bookmarking that manual, because if you're going to be responsible for accessing FIS through DDE and correcting, keying, or just checking claims, that's going to be important for you. So first, according to our list on this prior slide here, we're going to talk about accessing the patient's master record at Common Working File. So what does that mean? CWF. CWF is a single data source for Medicare entities, whether that be providers or contractors, to verify beneficiary eligibility, conduct prepayment reviews of claims processing criteria, not medical review criteria, but billing information. It's the only place in the fee-for-service claims processing system where full beneficiary information is housed, which is why we refer to it as the patient's master record. It's linked to Social Security information as well. Examples of the type of information it contains are listed here. Again, it's not an all-inclusive list, but some of the things are eligibility and entitlement information. So does the patient have Part A? As of when? What about Part B? Not every patient has both Part A and Part B, and they don't always start on the same exact date or even in the same exact year, depending on how the patient signed up for Medicare with Social Security. How many days did they have left in their benefit period? Utilization data such as that can be found on Common Working File. If you want to check whether or not they've met their deductible for the year, you can check that information. Will this patient be changing from traditional Medicare to a Medicare Advantage plan or vice versa? Are they changing from one Medicare Advantage plan to another? Is there another group insurance that might be primary to Medicare? Who is it? What type of plan is it? When did it start? Those are the types of things that you can find within the patient's master record at Common Working File. What else? Home health episodes, hospice elections, preventive and screening services, when they had their last one. Then you can calculate when they're eligible for their next one based on the coverage criteria for that service, test, or procedure. All of this resides within Common Working File. So this is an important gateway to that information. It's not the only source, but we're just describing direct data entry and the types of information that you can use it for and see within it. Next up is claims entry. DDE allows you to submit claims directly into FIS. This normally consists of several pages of entry that kind of closely follow the flow or the order of the form locators or fields on the actual UBO4 claim form. I have just a little example screenshot of what that form looks like. Again, some of you may have more experience than others on the line. So if you feel like I'm over explaining or talking down to you, I don't want to do that, but I realize that some of you are literally just learning about what this is and what you're going to do with it. So the within DDE do kind of follow along closely with the form locators on the UBO4. If you have a claim form in front of you, basically you're just going to go field to field to enter that information. There are edits that are built in that will help ensure cleaner claims and hopefully more error-free submissions. If you try to key in a field that's not allowed for the type of bill that you're entering, it'll notify you and stop you. When you send us a paper claim and you accidentally forget a field, we don't know what you meant. DDE can help trigger that and help remind you that if you're keying directly into the system, it'll give you a notice, or it'll highlight, or it'll even lock. Or if you try to tab to a field that's not allowed, it won't stop there. It won't let you key there. So the edits that it has are the same ones that our staff would see if they were keying your paper claim into the system. With DDE, you can electronically resubmit or update claims that are returned to you for billing errors. And that's the next thing that we're going to talk about. So I stated that the vast majority of claims that we receive are submitted by providers electronically, sending them in batches, but then using DDE to check their claim status, correct errors, things like that. If a claim edits with an error that only you, the provider, knows the resolution to, and I'm thinking maybe of missing information or a mismatch of certain elements on a claim, that claim then will stop processing and it will go to the provider's location to be fixed. And I know that's a little bit ahead of what we're talking about, but within DDE, this is known as RTP, Return to Provider. So it's a specific status location within this. And I know we haven't talked about status locations yet, but we're just getting started here. And these pieces will start to come together as we learn more. Claims in the RTP location cannot continue processing until whatever information is needed is added or corrected. Again, this is in the provider's file or queue to work. We're going to go more in depth on this subject in a later session on correcting claims in DDE. We'll talk about applications, we'll talk about working edits. So when you're working the claims that are in your RTP location, you'll correct the error according to what that reason code or that edit description says, and then you'll resubmit, reactivate, store, save, there's many different terms for it. So you'll update the claim by pressing your F9 key. Our second session will talk more about the keyboard functions for movement within DDE and what those different keys on your keyboard allow you to do in DDE. If you're listening to this webinar live, that session is actually tomorrow. If you're listening to this webinar as an encore, look to the direct data entry playlist to find that course focusing on navigation. So the last DDE benefit or capability in our DDE overview is the ability to access certain informational files. This inquiry ability actually allows you to research certain file systems with DDE. Some of the ones that are more common in the billing sector are the claim summary. So this is showing you the claims history for all of your pending and processed claims. The claim count summary lets you see a total claim count and total dollar amount by status location. Check history shows you the 3 most current payments to your PTAN, your provider number. And these could either be check payments or electronic funds transfer. The DRG, Diagnosis Related Group Pricer Grouper. That menu selection displays detailed payment information for hospitals who have their inpatient claims processed and paid under the prospective payment system. Most acute hospitals are paid according to DRGs. And so with this screen, you can actually look at how the system calculates payment by the Pricer and Grouper software programs. DDE also gives you online access to other files to help you with things like what revenue code and HCPCS codes are acceptable together. It'll give you descriptions and resolution for edits or reason codes. You can view lists of diagnosis and procedure codes. So those are just some of the things that you can do and see within the inquiries. So when we're talking about inquiry access and access to informational files, those are some of the types of things that you can do within direct data entry. So now that we know all of those things, how do we get it? How do we get DDE? And the very first step is to establish a connection. Users will need to connect to the DDE system, and that's done by working with a CMS approved, what we call a network service vendor. These are entities that provide connectivity services, but they don't actually have access to the content of the data that's being transmitted. So if you're worried about security, they're the door, but they're not the window into seeing the data that they're transmitting. I hope that makes sense. Approved network service vendors that have successfully completed testing with WPS are posted on our website. WPS tells you who the approved service vendors are, but we don't recommend one over the other. So we just list them there. They're in no specific order. We don't have any sort of incentive to recommend one over the other. We're just going to tell you who they are. Your facility may already have an established vendor that you work with. If you aren't sure, you can ask someone in your business office or a member of your administrative staff. Once a connection is in place, there are forms, of course, that have to be completed. Each facility will designate what's called a DDE authorized signer. The authorized signer has to register for a DDE submitter ID by completing the DDE submitter ID request form. These forms can be submitted and sent to WPS right from our website. To access DDE, a request has to be submitted by that authorized signer using the DDE electronic access request form. So once that authorized signer is in place, then they control who has access to the facility's claims and financial information. That first step is getting that authorized signer set up. And then as employees need access or leave and no longer need access, then that authorized signer is in charge of that. Other items that have to be in place before you can get started are the EDI enrollment form and the direct data entry EDI enrollment form. I know that's a lot to take in. I've thrown a lot of things at you in a very short time, but once that initial setup is done and verification is complete, as long as you don't become inactive, get revoked or deactivated, or you fail to recertify when that's required, that's another thing that's done by the authorized signer, then you don't have to go through all of that process again. If none of those things happen, then you're good to go. That setup process might not even be something that you're going to be involved in, depending on what your role is at your office or your facility. But it's still a good idea, I think, to have a basic understanding of what this process is and how all of these pieces fit together. So if somebody asks you, who's the authorized signer for your facility? You'll say, oh, that makes sense. I've heard about that before. It'll just help some of that information come together for you, hopefully. You can refer to the DDE overview article that I mentioned back on slide 8. I think it was slide 8. Let me see. Yeah, if you go to this article here, it'll tell you that information about getting connected, the 2 authorized approved network service vendors that we have, They're listed there, how to contact them, details, instructions about the forms, and things like that. So that brings me to the end of the information that I specifically wanted to share with you. Before I reach out to Karen to see if we've gotten any questions in the chat related to today's material, I do want to address a couple questions that were submitted during registration. First one, how do I update an original claim ICN number? ICN is internal control number on a corrected claim, or how to change a corrected claim to a new claim from an 857 bill type to an 851. And this is a little bit outside of the scope of our topic today, this being our first DDE session and everybody being kind of new to this information. But I will tell this person that you cannot change an adjustment bill type, which is what the 7 indicates in the last digit, to an original claim bill type on a claim that's already processed and been changed at least once in direct data entry. The 8.5 part of that bill type indicates that it is an outpatient critical access hospital. Asking there, I do suggest that you contact customer service so that they can look at your specific situation and provide more specific instruction for you if I've misunderstood. The next question that we received, where is the best resource to answer questions about the various fields in DDE? And the answer to that would be the DDE Manual. If you're not familiar, the manual does contain many screenshots and tables that define the different fields on each page. This is especially helpful because a lot of the terms are unique to DDE, and a lot of the fields are abbreviated in a sometimes unconventional way. So that's kind of a nice way to say it. If you've never looked at the screens in DDE yet, and you're just curious, go into that DDE manual. At the beginning of each section, it'll usually give you a little bit of background about that menu or that task or whatever the item is. And then as it goes through the different pages, you'll see a table, and it'll give you the abbreviated term or what the screen actually shows, and then an explanation of what that is. Let's see, what else have we got here? I guess that is all that I've received as far as pre-submitted questions go. I was just looking over the registration list there. So I'm going to reach out. Karen, do we have any questions in the chat?
Aline, thanks for all that great information. We have not gotten any questions in the chat.
That's okay. Thank you for looking, and thanks for being my eyes behind the screen here. When I'm sharing my desktop, I can't see what's going on in the chat, so that's why it's so helpful there. And I understand if you don't have questions yet because you don't know what you don't know. And so as you go further in and you attend more sessions and you're working with DDE and actually getting your feet wet in there, some of those questions might pop up for you. So we're going to move on here. I have a couple announcements and other items for you here. So please stay till the end of the presentation because I do have some important information for you. WPS does receive many overpayment notifications and refund requests from providers. And you want to do the process and repay Medicare in a timely manner, but there can be delays if not done properly. If you use an incorrect or an outdated form, if there's missing information on a form, or you send a check without explanation as to what it's for, things like that can also cause a delay. To avoid unnecessary holdups, consider using the SecureNet Access Portal, SNAP, that I mentioned. We have some features called refunds and overpayment claim adjustments. These allow for fast and efficient processing of your overpayments and refunds to Medicare. Now, there are times when you're not able to use the online portal features. We realize that. Instead, you may need to send a paper request and a paper check. But if you do, we recommend including the correct form. Those are available on our website. I'll have Karen place a link to an article on our website that'll help you determine which action or which form to use. The main thing I would tell you is don't send us a paper check without explaining what that payment's for. Different departments do different functions. And so if you send the check to the wrong department or we don't have an explanation of what that's for, the check will get deposited, but then we're not sure what to do with it. And so we want to give you credit for sending that refund in. So give us those details. Please and thank you. This slide is a provider alert. It's announcing a change. It's been in place for a little bit now, but just in case you weren't aware, that there was a change to mail delivery for Part A appeals that were submitted in the provider portal as of June 1st. Correspondence on appeals submitted through SNAP are sent now electronically. So effective June 1st, all providers with active SNAP accounts who submit their appeal requests through SNAP will no longer receive decision letters through the U.S. mail. All appeal letters can be viewed and downloaded directly in SNAP, our provider portal. Providers will also now receive an email notification regarding a decision on their appeal, and then that email also will give you immediate access to that appeals correspondence. This is the information about the National ABMAC Ambulance Supplier and Provider Coalition webinar. It's coming up later this year, but it is open for registration. So we're including this slide as an advertisement of it. This is a national, all contractors across the country. It's a webinar, so it's going to be held virtually on Wednesday, September 16th from 12 to 2 p.m. Central Time. If you're on the East Coast, in the Eastern Time, that's 1 o'clock to 3 o'clock, excuse me. The MACs are all going to present information on current medical review activities, additional documentation requests, and also what comprehensive error rate testing or CERT program review findings our ambulance providers are seeing. Registrants have the opportunity to submit questions ahead of time, so we do encourage that, but there will also be a live Q&A session during that webinar. If you want to learn more about the coalition, you can visit our ABMAC Ambulance Provider and Supplier Coalition webpage. And even if you don't provide ambulance services, it doesn't pertain to you and your job. If you want to help share it at association meetings or someone else that you work with, that would be much appreciated. Please take a few minutes to complete a survey about this course. Tell us what you liked. Tell us what we could do better. Give us suggestions for future topics. You do have a few options, so depending on what your preference is, you can use the link that Karen's going to place in chat for you. Or when you exit the webinar, you're going to be asked to go to an external site. And that external site is the CMS Qualtrics page for the survey. If you haven't attended one of our webinars before, that page is going to look a little bit like this top screenshot here. It has the triangle, the exclamation point, and the continue button. That is just letting you know that if you click continue, it'll take you to the survey. We don't have any control over what that verbiage says. And so if you've never seen it before, you might be a little hesitant, but it is safe. It's not spam or anything like that. It just wants to take you to the survey. If you're listening to this course as an encore, you're going to get a box that looks like the bottom picture here with the finger and the stars. And that's going to link you to the survey. You can also scroll down in the description for the video to find a link to the survey. However you choose to do that, let us know if you would recommend our education to others. How likely are you to other events that we host? Those surveys are so important to us. They give us insight into how we're doing and also the types of education that you want and need. You're going to receive an email from WebEx, and it's going to thank you for attending. It also has some important information in it, so don't delete it without reading it. It has your certificate of achievement, has your name, the title of this course, and your contact hours. So if you need those contact hours to turn in for credit towards continuing education units, you can do that. If you don't see it in the next 5 or 10 minutes, check your junk or your spam folder and make sure that you add the WebEx email address to your safe sender list so that you can get those emails on future webinars even, so you can rack up those contact hours if you need them. If you think of a question later, you can send them to our education mailbox. You can put today's date, something about DDE or direct data entry in the subject line. That will give the person who's watching that mailbox a clue that it is dealing with my webinar. They'll come to me. I will provide an answer. On behalf of myself, Karen, Shakura, all of us in Provider Outreach and Education, I want to thank you for your participation today. Thanks for your attention and learning more about direct data entry. We hope to have you join us for future education, and we definitely look forward to your survey feedback. Thanks, everyone. You can now disconnect.